Good evening, everyone, from beautiful Fredericton, New Brunswick. My name is Bob Hatheway, and I'm the Chief Clinical Officer. I'm excited to welcome you into my home office. We would love nothing more than to be back in our clinics with our fabulous team members taking care of you or your children's smiles. As you know, however, we cannot do that. Our doctors and team members are following the guidelines of the provincial dental regulators and the provincial health authorities, and we're staying home. We all have a part to play in flattening the curve of COVID-19. And even though in some provinces we're making progress, now isn't the time to get complacent. This is hard for everyone, but this is a critical point in time for Canadians, and we have to finish the job. Now, this doesn't mean that we've been sitting on our hands, however. We're committed to keeping you updated and communicating with you while our offices are closed. All your social media posts, voicemails, emails, they're all being read. And tonight is a step in the process to communicate directly with you and answer your questions. Our orthodontic offices have always been diligent to maintain the highest level of health and safety standards. And I believe dental clinics coast to coast and the people who work in them understand infection control as well as any profession. Dental offices have an extremely high standard of universal precautions, and all dentists take this responsibility very seriously, and that should give you comfort when it comes time to return to your family dentist's office or come and see us at the Doc Braces Clinic. If there are recommendations that are made by the regional health authorities or the dental regulators that come from this, we will ensure we are up to date on any new safety measures that may emerge. Now, you're not tuning in just to listen to me talk. You want questions answered. We've had a number of them come in over the last 24 hours. The beauty of Facebook Live is you can post your questions during the broadcast. So I'll do my best to answer them, but if I don't get to your question live, we will respond over the next 24 to 48 hours. And many of you have the same questions, so let's just get right to it. So here's the first question that came in. Crystal, she sent a question and asked, my son's got a loose tooth, and it's the one that's attached to his wire. If that tooth falls out, what should we do? Well, Crystal, if that tooth is loose, it's because it's a baby tooth. And if it falls out and it's not bothering him, then you can probably leave it. If it is bothering him, however, you can just reach out to us and we can either talk you through how to unhook the brace from the wire or clip the wire. And I would encourage you to jump on the website, and the Doc Braces website has a whole Q&A of different emergencies and those sorts of things that maybe will have popped up, and you might find the information that you need there. But if it's a loose baby tooth and it falls out and it's not bothering him, I would just say leave it. So that's a good question, Crystal. Next question I have here is from Jenna, and Jenna asked a great question. Her question is, one of my Invisalign buttons has fallen off, but I'm still wearing my aligners. Good job. Make sure you keep wearing them. Her question is, will this change my treatment time or the treatment outcome? And really, the short answer is no to on both ends. As long as the aligners are still fitting, then you should be having no problems as far as the teeth continuing to progress. Now, that one tooth, it might not quite progress the way that you want it to or the doctor wants it to, particularly if this carries on and on with our shutdown. And so once the clinics are opened up again, and if you need to have a scan done to refine that one tooth, you can be sure your doctor will look right after that. So great question. Now, I just want to touch on Invisalign while we're right here. For all of you listeners and watchers who are wearing Invisalign aligners right now, we recommend that you reduce the aligner wear, you increase the number of days between changing your aligners. So many of our patients would be on 7 days per aligner. And so the recommendation that we're making is that you go from 7 days to 14 days per aligner. It slows things down a little bit, yes, But what we don't want to have happen is we don't want you to run out of aligners while we're closed down. And so let's just slow it down a little bit. Keep wearing them all the time. Of course, just take them out to eat and clean your teeth. But other than that, keep them in place. Just do that for 2 weeks instead of one. So thank you for that question, Jenna. Oh, here's a good one. So Deb, she asked a question. My daughter's retainer was misplaced, and her braces were just removed about a month ago, and she can notice that her teeth have shifted. So what's my advice? That's a tough one because there isn't a whole lot that we can do, unfortunately. Now, when the clinic opens, your doctor will get a chance to assess the teeth, and I can assure you that they'll get right in there and put those babies back in the right spot. We want to recover that fabulous smile that your daughter has, but right now we just can't get in and make you a retainer. So my promise to you, though, and our commitment to you is we'll put them back where you want them, and it'll be just like it never happened. Great question. Thank you, Deb. Here's a question that we've been getting a lot of this one. So my question for Dr. Hathaway from Tammy is, why are you unable to mail me elastics? You know what? That's a great question, and we're actually working on changing that policy. So I would encourage you to stay tuned. Um, what we're doing is we're following the regulations that are put in front of us from the health authorities and the dental regulatory authorities. And so it's important that we follow those rules. And as far as the elastics go, we are working internally on a policy that can help you get some elastics that keeps everybody separated and not interacting with each other. Now, if you do have elastics right now and you haven't lost them or you haven't run out, just like the aligners, we want you to wear your aligners for 2 weeks. Well, when it comes to the elastics, just wear your elastics at night, even if the doctor has prescribed to you day and nighttime. So nighttime wear means we're holding things where they are. Day and night means we're trying to change something, we're trying to move it. So if we switch you to just nighttime wear, then we're not worried that it's going to overcorrect. And that's an important thing. We don't want to go too far and then have to unwind that and move them back in the direction that they came from. So if you've got rubber bands, wear them the way your doctor prescribed, but just wear them at night. So excellent question, Tammy. We're going to get that figured out on getting things mailed to you. Michelle has an elastic question as well. She's continuing to wear her elastics, but now she's noticing that she's getting a gap between her front teeth. Back to the same thing. Look, wear those elastics just at night. I don't know that the gap will close that has opened. But look, if it is there, if there is a little bit of a gap there, by the time you can get in to see your orthodontist, I know that they'll be able to close it up just like that for you, and you won't have to worry about that space being there. But in the meantime, just dial the rubber bands back to maybe nighttime wear, like I was saying before, and that'll just hold things where they are, and hopefully that space won't continue to increase. A lot of great questions, and we had so many questions, dozens and dozens of questions that came in. So you may not hear your name or get your question picked out, but rest assured that we've got these questions grouped, I guess, if we can, to have a sample of what's there. So let's jump over to live here. Here's a good question. So Tabitha asked a question. I'm hoping to get my son into treatment and wondering if you think your offices will have a big backlog, or will you be back into business as usual when things are open? Well, I mean, we hope there's a big backlog of new patients that are coming in, but the truth of the matter is that we're going to focus on getting ourselves open as efficiently as we can and have the resources that we need in order to be able to see people that are in treatment and see those folks that want to get going and begin treatment. So we're working internally to really try and prioritize the patients that are in treatment so that the ones that are urgently needing to be seen, we can see them and keep their treatment moving along. But I have great faith in the way that the team is working here, and I really believe that we're going to be able to get everybody through and have a really minimal backlog. So thank you. That's a great question. So thank you for that, Tabitha. Lots of live questions here. Here's a good one, Trisha's. So my daughter is due to have braces removed very soon. She's missed the last two appointments leading into the removal date, and is she going to be delayed in removing her braces? Well, I would expect that the first visit back will not be a braces off, pardon me, not a braces off appointment. I think that the first visit back will most likely be one where you'll get evaluated if any changes need to be made to fine tune things so everything just fits right the way that it should. So I'm quite hopeful that you won't have any significant delay in the braces coming off, because we know that's the most exciting day that there is when it comes to orthodontics. All right, so great question, Tricia. Let's see what else have we got here. Julie's asked a question. I've been wearing them at night only for a month now, but I only have 4 left, with a funky emoji that's there. Yeah, great question, Julie. So look, stick with night still, and maybe 2 weeks per aligner. Hopefully 8 weeks from now, we're rocking and rolling again, and you're able to get some more aligners. Just like the elastics and the wax we touched on a little bit earlier, we want to see if we can come up with a process where we can perhaps even get some aligners to you. So I know that that's been a frustration for everybody. We're working on a process so that we can do that while still respecting what the dental regulatory authorities ask of us during this, difficult time. There's no playbook for this. We're doing what we believe is the best, and we're getting this feedback. And so, great feedback from everybody. Thanks. Let's see, Julie asked a question about rubber bands, so I touched on that one. Um, Sonia's question: same aligners for 4 weeks, and I have no more. How long will they last? Okay, so aligners, if you switch to just nighttime wear, you can get quite a bit out of the aligner. Um, if it's your same tray and you have more trays, then we're hoping to be able to have a process where we can get you more. If it's your last tray and that last tray is starting to fail, then I know we have a process where we can get you a tray to hold things in place. It's very likely going to come directly to you from Invisalign. So Sonia, let's make sure that you connect, and so we can follow up on that and make sure we've got it covered. Great question. We've got some new questions coming in. I'm going to go back. I'm going to go back to the questions that were sent in. Let's see, where were we? So that one was a question about shipping aligners. Yeah, so the shipment of the aligners, we're working on that, like rubber bands and wax. Um, Wearing elastic at night, recovered elastic at night. Okay. Candace asked a good question. I had a bracket fall off, and I was able to follow your emergency guide online. So remember, there's a guide online that talks about all kinds of different repairs, emergencies, different things that may come up. So her question is, I'm worried now that if it will be bad for treatment not coming into the office for so long. Really, a short answer to that is it will not be bad for treatment. If you have a loose bracket, it's not going to have a negative outcome for your orthodontics. Now, just like the first question that I covered, where we had someone who had lost an attachment and she's wearing aligners, if the brace has come off, that tooth may not move exactly the way that you want it to. And so if that needs to be, when that brace goes back on, it won't take very long to get the tooth back in the right spot. I'm sure your orthodontist will be able to fix that one up very, very quickly for you. So not bad. Don't worry about it. And they'll be able to fix it up right away. Here's a unique question, okay? So Shelly sent a question along here. My daughter had elastic spacers put between her teeth, so that's to fit the appliance, and they fell out. Well, we just start at the beginning again. So no, the appliance that's been made from the mold or the scan, that will fit for sure. I would be shocked if it didn't fit. The spacer, however, the purpose of that little spacer is to create just a little whisper of room between the teeth so that the expander or the appliance, whatever is being made, can easily slide onto your teeth, just like a ring would slide onto your finger. And so I suspect what will happen is the spacers will go back in, and a week after that, or 10 days, or however long your orthodontist prescribes, a week after that, your daughter will come back in, and the spacers will come out, the appliance will go in, and you don't have to start from the beginning again. The restart is probably putting that little separator in. Let's see now. Chantel, daughter had her bottom braces placed about a month ago, but could they be too tight by any chance? Her tooth got pushed back a lot, and it's getting worse every day, and she complains that it's hurting a lot. What are the tips? Uh, I mean, it's possible that a brace has come loose and it's forcing the tooth back. It's also possible that the teeth were quite crowded, and so when they started to straighten themselves out, if these two started to move together, then they'd have a tendency to push the other one back a bit. Your orthodontist is going to put a little spring or something in there to make some space to bring that tooth back into position, is what I expect. And so I don't expect that it will be a long-term problem. The fact that it's hurting or uncomfortable on that area, if it's because it's scratching her tongue, um, that's, I don't have a lot of suggestion around that. If it's uncomfortable because of the tooth moving, then uh, I suspect that that discomfort will go away, especially if she's just recently had her braces go on. Um, and in the event that the pressure doesn't subside, the discomfort is still there, then perhaps what you could do is just take an anti-inflammatory type med, an Advil or something like that, and hopefully that'll take the edge off. A lot of talking, so I'm going to get a drink from my New England Patriots glass. For those of you who can't tell what my favorite team is, no pat either about Tom Brady or anything. Let's see. So those questions are covered. Carla asked the question, back bracket is off and wires poking. Can I clip the wire to remove the last bracket? You sure can. Jump on the website and there's some information there about how to go about that if you need a little bit of guidance. And I have a note from Miss Georgia. Hi, Georgia. Thanks for tuning in. Let's go back to our questions that were sent in advance. Sandra asked a great question. My son has an appliance and he's having trouble keeping it turning. When can we stop? So stop now. Um, how appliances typically are instructed is what you'll be given. I might put in an expander and I would say, okay, please turn the key once a day for the next 28 days, 4 weeks, and then we'll see you. Well, when day 28 rolls around, whether I see you or not, the expectation is that you would stop. And so we don't want people to continue and continue and continue turning appliances. So now, do I know if your son's appliance is all the way? Is it too far? Is it not enough? That I don't know the answer to. But I can tell you if you stop turning it now, then it won't go any further, and then we're not at risk of going too far or the appliance failing in some way. So if you have an appliance that has a key or a screw or something in it that needs turning, please stop turning it now. Don't worry about it slowing you down. Don't worry that you may have to restart it again later on. Everything will work just fine. Great question, Sandra, and that's a unique one, so thank you for that. Let's have a look here. Uh, no, those are just responses. Okay, thank you. So Jonathan asked a question that I think is a really good one. If we're not coming in, why do we still pay? I think that's a great question, Jonathan. So the payment plans is determining the amount and the frequency. Sorry, the payment plans are for convenience, I guess, for you in order to be able to take the fee for orthodontics and spread it out over a period of time. It's not really tied to the number of appointments you have. In some instances, someone might need 20 appointments to straighten their teeth. Someone might need 15. Someone might need 30. Some might be 12 months. Some might be 30 months. We create the payment plan structure to take the fee that is charged and your investment that you have in your orthodontics and just spread it out over a convenient way. So that's why we ask people to continue to pay, and because it's just not reflective of the visits that are being seen. So great question, John. Thank you for that. Lila asked a question. I've got a power chain and it's getting difficult to keep clean. Can I remove this, or is it essential that it stays on? So first of all, if the hygiene is an issue, I would encourage you to have a look at Linda's video. It's on our website. It was done live a day or two ago. And Linda's one of our dental hygienists who really is fabulous at helping out with in the clinic and making sure that everybody across the country from coast to coast has all the tools and training and things that they need to deliver the clinical experience that people need. And Linda's video touched on hygiene. Now, specifically to this power chain question, if you take the power chain off, the wire is probably going to fall out. So now things are likely going to start to shift in directions that you don't want to. So my preference is that you do not take the power chain off. My preference is that you leave the power chain on and just see if you can work harder at getting everything good and clean around there. I totally get where you're coming from. We'll have people that miss an appointment and it might be 16, 18 weeks between when a power chain went on and when we finally saw them. And it can accumulate a little bit of plaque on it. So we want you to keep it clean. If you've got to get it off, take it off. But really the preference is to work hard at keeping it clean, because if it comes off, the wire comes out, and then things are going to start probably moving in a direction that you don't want. So I hope that answered your question, Lila. Here's an Invisalign question, but a little different spin on it. Dominic's question was, my Invisalign aligners are not fitting correctly anymore. Is there anything I can do? So when the aligner's not fitting anymore, it probably means that you're ready for a new scan. If I think about how I would operate an Invisalign situation, I might take the first 6 or 8 months and just get out of the weeds a little bit, get the teeth straightened a bit so I can move on to fixing the bite. And I suspect that your aligner's not fitting because you're probably getting close to the point where we're ready for some new aligners to be made pretty soon. How I would approach that right now, because we can't get you in and do another scan, is just reduce down your aligner wear to part-time so you preserve the integrity of it, and wear that aligner, just that one aligner. Don't advance any further. If you're on 31 and 32 is just still not fitting great, get as much as you can out of 31, stay there for the next little bit, and then if 31 fails, move to 32, because maybe the extra length of time with 31 will get it fitting a bit better. But see if you can slow things down by going to part-time wear and try and stay in that one aligner that you're on. So hope that answers your question, Dominic. I've got some questions that have been added in. My wire in the back isn't attached to the last bracket anymore. I also have a certain tooth that is hurting but is not near the back. Could it be moving from the wire being detached? It's possible. It's possible it could be moving from the wire being detached, and that might be causing a little bit of an interference that's causing the tooth to get a little bit tender. I certainly am not too concerned about it. I don't believe that if it moves a little bit in an unfavorable direction that you have to worry about it coming back when we can get everything tied back in place. So if the wire is bothering you, get some wax on it if you can, or once again, go to the website and there's a bunch of there's a question and answer section that's there about tips and tricks on how to deal with some of these things that pop up, quite frankly, all the time. All right, so let's see. Back to our questions here. Fitting. So Brenda asked, I'm getting some sores in my mouth from rubbing against my gums and I don't have any wax. What are your tips? So I was just going to reiterate the wax, elastic, and Invisalign question. So let's do wax first. If we can get the wax to you, we will. But most of the pharmacies have wax available in the oral hygiene section. So what I would recommend is you zoom off to your closest pharmacy. check in the oral hygiene section. And I'm pretty sure that they're going to have some orthodontic wax there. If that one doesn't, the one down the street probably does. Um, and then once again, with the liners and elastics, we're working towards a process to get those to you. Um, it's not that we don't want you to have them. It's that we're working under the umbrella of the dental regulatory authorities, and we're working collectively with them to make sure that we're following the guidelines that they've put forward for us. We're working on a solution for you though, so hang in there. Great question here from Sherry, and we're getting close on time, so I'll get through the last 2 or 3 questions here. Sherry asked, I was due to get Invisalign this month. Should I be concerned that my teeth could move from the scan that was already taken and everything needs to be restarted? Really, the short answer to that is probably no. The scan that's been done on your teeth and the aligners that have been made that are in sort of holding pattern getting into you, I'm almost 100% sure they're going to fit all right. If they don't fit, of course, we'll make a new scan for you, but I think it's a very, very unlikely, Sherry, that they won't fit when we're open and able to deliver those aligners to you. That's a wax question. What happens if a wire comes loose? That was in that same basket. We've talked about that before. Oh, Francine, this is a great question from Francine. If our treatment time goes longer because of this, are we going to be expected to pay more? And rightfully so, she says, I don't think that would be fair. And you know what, Francine? That wouldn't be fair. I would agree with you 100%. And so, once again, the treatment is really a fixed amount. And so, your case, if it takes a little bit longer because of all of this delay, there is not going to be any more fee, additional charges, or anything for you to get the outcome that you want. That's an expander question. Let's see now. We've got one more on here. Let's see. I've got to catch up. Hey, Corin. Oh, yeah. Hey, Corin. Okay. I see you in the Truro office. Fabulous. So I have a huge gap in my teeth now, and as body cosmetic, I wonder how much longer do I have the spacers because they're hurting my tongue and cheeks. Sad emoji. Corin, here's what I'll do. I can get onto your file from my computer at home, and I'll have a look and see if I can answer your question directly. Thank you for sending that in, and it's hard to get the answer the specifics because I just don't remember exactly what's in there. But hang in there. I'll get on the chart when I can. And that's an Invisalign question. So Rachel, we're working on that. Retainer warranty, will this be extended due to the closure? Carla, I'm not sure I can answer that question because there's not everything that they tell me that in this organization. So the retainer warranty, I don't quite know how it works. So will it be extended due to the closure? Probably, but I don't know that I can answer that question for you because at times I'm on a need to know basis on how this whole operation works. So great question though, Carla. Thank you. Gloria, great tip from Gloria. She saw orthodontic wax being sold at Walmart. So for all the listeners that are on there and viewers, there's wax at the Walmart. Linda jumped in there with the tip. Baby Bell cheese wax will work. Oh yeah, those little red ones on the Baby Bell. It means you got to go buy the Baby Bells, I guess, if you don't have them. We covered attachment falling off. And my retainer is cracked. Great question. Good one to finish on. My retainer is cracked. Do I just wear it the best that I can? Short answer is yes. Let's say you've got one of those little clear plastic retainers that's broken in 2 pieces. The 2 pieces will probably still fit. And so wear that. Wear it at night, probably not any through the day. Minimize the number of times it's coming in and out. And as soon as we can get back in and see you in the clinic, we're going to get you a new retainer. So Stephanie, thank you for the question. So look, we're coming up on the 30-minute mark. A lot of fabulous questions. This is going to be posted on the website so other people can have a look at it. We're probably going to do this again if there are more questions that come up that need to be answered. I appreciate everybody taking the time out of their schedules tonight to jump on to Doc Braces Live. And I want to give a shout out to the first responders. So I've got some great friends that are firefighters and physicians and nurses and folks that are involved in the front lines. And so to you, I see all the caps in the back. If I had one on, a tip of the cap to all the first responders for the work that they're doing. And remember what I said at the very beginning. We're flattening the curve. We're going to get out of this, but now is not the time to be complacent. Let's keep following the directions of the chief medical officers of each of the provinces. We'll keep following the direction of the dental regulatory authorities. We're staying home. I'm getting to spend a lot of time with my family, enjoying. I tell my kids every night that I haven't had dinner with everybody for like 3 weeks in a row at the supper table. I couldn't tell you when it was the last time that we did that. And it's just such a wonderful experience for me to have that family time with them. And so I hope all of you are having the family time as well. So it's 30 minutes. Appreciate everybody taking the time. And we look forward to seeing you once we're open again. Good night, everybody.